Hi, I'm Paul Halverson, and it's my pleasure to be with you today. I serve as the founding dean and professor of public health at the Richard M. Fairbanks School of Public Health at Indiana University here in Indianapolis. And I'm also privileged to serve as a member of the governing board here at Castleton United Methodist Church. And in my capacity as the dean of the School of Public Health, my faculty and I provide consultation and research, supporting our health departments and hospitals across the state of Indiana. We're especially proud of the relationship we have with our Marion County Health Department and all of the organizations that really care a lot about the health of the people here in Indiana. So Pastor Jen asked me to speak a little bit today about the coming back, the regathering of our church members to an in-person environment, and I'm happy to do that. I wanted first just recognize the fact that churches across Indiana are coming back in different ways and in different speeds. And this is a pretty big decision, I think, for all of our churches. And I just want to say how proud I am of Castleton for the way in which we have moderated our return to a different normal. That we are cognizant of the different challenges that we face because of COVID-19. And I think we're taking a very science-based approach to being careful in making sure that everyone is considered as we think about the new normal that we're approaching. And so, again, I don't think there's a right or wrong. I believe that today, as we consider all of the various options, again, I believe Castleton's moving in the right direction towards gradually returning to more activities as we regather in perhaps new and different ways, but also recognizing that it's going to be wonderful to be back together again, even if there are different and new aspects of our worship. But again, let me just spend a few minutes talking to you about the reality of COVID-19. So today in Indiana, our new cases are down. And we've seen substantial decreases in hospital admissions and deaths. All that's good. But there are a couple of things that give me some pause. One is, even though the number of new cases is down, we still have about 800 new cases a day. And we are also seeing some increases in new cases among young people, particularly people in middle school and high school. Now, again, the good part about that is we do know that this disease is particularly harmful to our people that are over age 60. And so young people, when they get the disease, they generally aren't the ones that are in the hospital or that die of this disease, although, again, we know examples where that has occurred. But the reality is our cases are down. We're not absent of this disease, and that's the important thing. So we must take precautions. The other thing that's important to recognize is that we do have a new variant of this disease. In fact, there are 2 or 3 variants that we're very concerned about. And I have to tell you, as someone that studies this disease, I think that we don't know as much as we need to know about this new variant. And as we see this variant in particular, the UK variant, it appears to be much more active, much more infectious, and frankly, we're not exactly sure how it will play out. And so again, I will tell you that although we are seeing the number of cases decline, we also need to be very cognizant of the new variants of this disease, because they may present to us new challenges in terms of infectivity and lethality where we just don't have all the answers right now. So I guess the message is that as we think about a new normal and coming back into a time of regathering, we need to be cognizant of the fact that this is not necessarily a done deal. We are not necessarily on a slide that will bring this disease to an end, but we believe that we're moving in the right direction. And so we have to be aware, cognizant that this is happening. So the other thing is that vaccine coverage is increasing, and that's wonderful. And in fact, here in Indiana, we actually are a couple percent higher than the U.S. average as it relates to vaccine coverage. Now, we're nowhere near where we need to be to have herd immunity, not even close, but we're making progress. And it is encouraging that we're doing well. And again, I give a lot of credit to our local and state health departments. They're working very hard to make vaccine available. And I know there will be a time very soon where vaccine will be available to everyone. And so that's also a very bright light when it comes to this disease. So as we think about the future, we think a lot about the impact of the vaccine. That really is the light at the end of the tunnel. And this vaccine, and there are many of them, is very, very important for us as we think about ways in which we can regather. So as we consider regathering to in-person services, there are a couple of things that I think are really important. Number one, vaccines should be the expectation for our social compact. Remember, we need to do no harm, and that means not just to ourselves, but to others. So the issue here is that we need to vaccinate so that we can protect those around us. And, of course, we protect ourselves. But part of being in a social environment, like a church, is doing all that we can to protect ourselves and others. And so, again, the vaccine is not a political issue. The vaccine is a scientific undertaking that creates a movement towards immunity, and that's why we all need to have that vaccine. And I would just suggest to you, as someone who studies this disease and studies vaccine and the importance of vaccine, everyone should get this vaccine just as soon as you can. This is actually going to be the most life-saving thing that we can do, coupled with some of our prevention strategies. So as we think about coming back to normal, if you will, we need to recognize that vaccine is an important component. It's an essential component, and we ought to do all that we can, not just for ourselves, but for others. And we ought to make sure that those we love and care for get that vaccine just as quickly as possible. So for your neighbors, for your friends, for other members at church, if you know they might have a difficult time either getting a reservation online or getting to their vaccine, this is a time we all need to reach out to help each other to get the vaccine. So while we're increasing our immunity through the vaccine, and as we're gaining ground with this disease through increasing immunity, we still will need to do some things that maybe some of us don't like, but we're going to need to continue to wear masks, and we're going to have to continue to social distance between people that are not in our household groups. This is really important. Again, our hope is that this will not be a forever thing, but that while we're in this transition period, it's so essential for us to do what we can to make sure that we're doing all that we can. And in particular, remember that 40% of the people with this disease don't have any symptoms. And so it's important that you recognize that wearing a mask and socially distancing creates the opportunity for us to provide that barrier and that protection for others as well as for ourselves. And again, making sure we wash our hands and being mindful of germ transmission. Again, this disease is primarily, now we know, it's both droplet and aerosol. And that means that, at least in the transition, we're going to have to limit congregational singing. Not forever, but while we're in this transition, while we're finding this new normal and finding increased immunity, we're going to need to do that. Remember, don't come to church if you or a member of your household is sick. This vaccine is highly effective, but it's not 100%. So remember, it's still possible to get the disease even if you've been vaccinated, even though it may be a very small probability. We do need to make sure we take precautions. So if you're not feeling well, don't come to church. There needs to be, and there will, and I'm assured by Pastor Jen, that there will be options, virtual options that will continue to be available, especially for people over age 60 and those with chronic medical conditions, as well as those that have compromised immunity. As you remember, the mortality from this disease is substantially higher in people over the age of 60 especially. So it's very age-related, and so we want to make sure that we provide virtual options. We want you to come back when you feel comfortable, but in particular, we need to be extra cautious for our people over age 60 and continue to provide that virtual option. And again, my thanks to Zach and all of the folks at the church that have made virtual options such a high quality experience and so important as a way to continue our worship experience, even though they may be virtual. Gatherings in church by those vaccinated are still regarded as public events. You may have seen the CDC announcement around being able to come together if in small groups with others that may have been vaccinated with their 2 vaccines for a minimum of 2 weeks. You can come back in small groups and being able to gather in your home. But public events still require that we take precautions, and those precautions for us include wearing a mask and socially distancing, at least for now. Again, it's not a forever thing, but as we transition, we all need to do our part to make sure that we're doing church as safely as possible. So remember, we're getting closer to that light at the end of the tunnel, but we're not there yet. 800 new cases a day is not insignificant. It's important to say we're making progress, great progress, but we're not done with this disease. It's not done with us, I'm afraid. And so we need to make sure that we're paying attention. There's 2 things that I always talk about with our students around this disease transmission. It's called density and duration. And again, let me just say that we need to avoid large gatherings. And that's just important as we think about and we move through this transition. Stay away from large gatherings. Make sure that you are socially distanced. And the duration part is important. So in order to get this disease, there needs to be the longer the duration of exposure, the greater the likelihood of contracting this disease. So stay out of large groups. Don't stay for a long period of time. Reduce that exposure and potential for transmission. There's a lot of great things that are happening, and God has blessed us immeasurably. We're almost there in terms of our ability to see this light at the end of the tunnel, to see immunity and being able to move beyond COVID. Let's just hang on for just a little while longer as we think through strategies to bring us all together safely. Thank you again for the opportunity to be with you.
Hi, Pastor Jen here, Senior Pastor at Castleton United Methodist Church. You just heard Dr. Paul Halverson talk a little bit about the science and moving forward, and just want to mention again what he was talking about is just while we're gaining immunity, just while we're moving out, just in this time period, we are just going to continue some precautions, and we're going to move with that gaining. So we're going to move back to regathering in increments as we gain that immunity. So April 4th is Easter, a high holy day of celebration and joy. There will be a 9 and 11, but we will be meeting for outdoor worship at 8 a.m. You can either stay in your cars or get out. It's going to be beautiful. We're going to worship together. We're going to sing together. It's going to be joyful. And then April 11th, the youth will regather. Club 56 and our youth begin gathering in a new schedule on that week in socially and COVID-safe ways. And then April 18th, we continue to grow our families coming back, regathering in worship with that idea of splash as we grow that service. And then April 25th, our larger groups will come back. So we'll exceed the 25, we'll go to 50, and we've got all those safety precautions in line, but our larger groups are going to be coming back. And then May 2nd, we will be regathering in worship in the building. Now, you heard Dr. Halverson talk about concerns around density and duration, and so we know that some people will still be worshiping online. They'll be with us. Some people will be, but we won't be so dense that it's unsafe. We will be together and worshiping. You'll learn more about how and when and where and what that looks like, but I hope you're planning however you feel safe, what is good for your body, but know that we are regarding life. We will be able to come back safely. We will be able to worship beautifully together. And again, that fullness begins on May 2nd. So we are moving back in line with the ways that we are building immunity, so that we can honor everyone, regard human life, do no harm, and worship together as God people. You're going to be hearing lots about this, and so I hope you're getting excited. Invite your friends, prepare yourselves. Let's get together to worship the living God. We'll talk more soon. Peace to you.